Welcome everyone to National Apprenticeship Week. So this is actually day 4, and we hope you're having a great week learning about all the different types of apprenticeships available in around us, and seeing actually the diverse range of apprenticeships actually available. Today we're joined by Abigail, who is doing an apprenticeship right now in healthcare, looking at neurophysiology. So today Abigail actually works at East Hospitals, and she'll introduce herself in one sec. Just to let you know, at the end of the talk there'll be an opportunity to put in questions, so please use the Q&A chat and we'll try and get through as many questions at the end. Thank you, Abigail.
Hi, so I'm Abigail Seeley and I'm just going to be talking about considering an apprenticeship in healthcare, specifically in neurophysiology. So what is neurophysiology is probably one of the questions you're all asking. It's not something that's well known. What I'm going to be talking about today is what it involves, what an apprenticeship in neurophysiology involves, how I came to study neurophysiology, what I did prior to this apprenticeship, how my time is split between work and study, and what I enjoy about my job. So a little bit about neurophysiology first. It's a branch of physiology and neuroscience that studies the function of the nervous system. So that's the brain, spinal cord and the nerves. And it's used to diagnose and monitor a range of neurological diseases that affect the brain or nerves, such as epilepsy, carpal tunnel syndrome, encephalitis, multiple sclerosis, or hypoxic ischemic injury, or also known as a brain injury. This is just one of the tests that we do, just to show you a little bit about what I do every day. It's called an electroencephalogram, or an EEG. So the top left picture sort of shows what the test looks like. We stick on 23 electrodes, these little wires, onto the head with some sticky paste so it doesn't hurt. It's just a little bit cold. You measure the head, stick them all on to cover all of the different lobes of the brain. And then we stick 2 onto the shoulders to pick up an ECG as well, to pick up the heartbeat. And what it looks like is the top right picture. This would be a normal one, and it just looks like a bunch of wiggly lines. And my job is to interpret these lines and to be able to write about them. And as you can see, the bottom pictures, these are some abnormal traces, and this is the sort of thing that you learn to differentiate and you learn to talk about, and these are helping you to diagnose different diseases and disorders. So what an apprenticeship in neurophysiology involves: I'm studying my apprenticeship with UWE Bristol, and I'm working in Canterbury Hospital in East Kent Trust. So it's a 3-year bachelor's degree in neurophysiology, and it's paid for by your employer, so you don't pay for it, you don't need a student loan. It involves weekly lectures online. On a Wednesday I have a study day, and I have all of my content delivered online, so I study from home. And there are 3 block weeks at university every year. So I go in September, January and May, and I go for a week in Bristol, which is also paid for by my employer, to travel and stay there for the week, which is a lot of fun. And then, as I mentioned before, I've got 1 study day, and then the other 4 days I'm at the workplace. So I'm in Canterbury Hospital performing tests for patients. So the salary, I'm employed on a band 5 annex, which means it increases every year as you gain more experience. So it starts at £22,477 and increases every year, as sort of shown on the slide. And then when you graduate, you're earning about £28,500. And again, that still increases as you gain more experience. So I mentioned before that I'm studying with UWE. As far as I'm aware, in England, there are only 3 courses that do this. They are UWE Bristol, Middlesex University and Manchester Met. When you apply for one of these programmes, you apply for it with the NHS Trust themselves. So you don't actually pick which university course you study, but they are all very similar. I've looked at the course content and I think they're all pretty much the same across all 3 programmes. It will just depend on where your NHS Trust would want to send you. So a little bit about the entry requirements. Ultimately, as I mentioned before, it's the NHS Trust who are employing you. So when you apply for one of these jobs, you apply with the trust and you apply with the hospital, and they will set out what the entry requirements would be. But usually, I think quite typically, is about 2 A-level subjects within a science. They like you to have either biology or chemistry normally, particularly biology is looked at quite highly, so it's quite important for this degree. And the 3rd A-level in something else. It doesn't have to necessarily be a science subject. However, I know there are a lot of equivalents as well, T-levels, Irish Highers, baccalaureate, they are all also considered. It doesn't have to be an A-level subject, but that would just depend on the hospital that is employing you. These are the entry requirements put out by the university, so they range quite a lot. One of them just states that you have to have 1 A-level in a science subject, and that can include things like psychology and maths. Another says you need 3 A-levels at grade B, or at least equivalent UCAS points, and that needs to include at least a C in biology, human biology, or an equivalent. So biology is quite important. And another one just says, as long as your trust are happy, it's usually 2 A-levels, but that they're quite happy to take you as long as the NHS trust thinks that you've got something that you could do the course with. So a little bit about university again. So I mentioned I go for 3 weeks a year. So this is in September to introduce the year, in January and then in May. So this is where you have lectures, you might have some assessments, this can involve presentations and exams, but you also have a lot of fun. You get to meet other sort of course mates from across the UK. So you all come together, people were coming from all over. As I mentioned, I go to Bristol, so it's not exactly nearby. People travel quite a way for this, and it's a really nice opportunity to meet other people studying the same course and to keep in contact in the future. I have weekly lectures, coursework, exams, and a portfolio to build as well. So it's quite a lot of work, and it does need a lot of self-discipline to be able to do that, because you are working full-time as well. You're not just studying all day, every day. So a little about me, so how I came to study neurophysiology. So my GCSEs were in English, Maths, Triple Science, French, History, Philosophy and Ethics, Business Studies and Citizenship Studies, so quite varied. I didn't just pick one thing. And then I really liked science, so when I went on to study my A-levels, I did biology, chemistry, psychology, and I did an AS level in sociology. I actually then went to study a degree in neuroscience at the University of Nottingham, so I did do it the conventional way as well, rather than an apprenticeship. But when I was at university, I did some work experience in a neurophysiology department, and it really opened my eyes to the fact that I didn't know neurophysiology existed, and that was something I found really interesting. And from then on, that's what I decided to do. It's quite a difficult field to get into. So when I came out of my degree, I found the apprenticeship and thought it was a great way to get into the field. So I'm now studying a healthcare science degree in neurophysiology. And I just really like to point out how important the work experience was for me. It doesn't have to be sort of later on in life, it can be whenever you want to do it. But I didn't know anything about neurophysiology. And if you're unsure about what you want to do, it's really great to get some work experience and just go and see what departments and areas, what they actually do every day, and if it's something for you, because it's not something I thought I would want to do. And when I went into the department, I fell in love with it. So I would recommend just going and contacting places and seeing if you can get some experience if you're not sure. What I enjoy about my job, I get to see a range of people every day. So I see day-old babies up to the elderly. I see people my own age. It's really varied every day, which is really nice. And I get to perform a variety of tests and settings. So I'm not in one place. No 2 day is the same. I work in outpatients in a hospital, but I also go on to wards and other areas. So it just keeps the day and the work really interesting, really. I get to apply scientific knowledge to clinical situations. So everything I've learned at school, at college, at university, I then see patients who suffer from these diseases, and it's really good to be able to apply what you've learned to help other people. I see a range of different disorders and diseases. It's all varied. You see a wide range of different things, and you get to be a part of a patient's diagnosis process. So you really feel that you're helping someone and helping them get the treatment that they need. And the people I work with a lovely team, and I think that's really important about enjoying your job, is who you work with. So why and who should study a neurophysiology apprenticeship? If you like working with people. If you don't, it's probably not for you, because you do need to be able to talk to people every day, which for me, I love being able to talk to people and interact with everyone. If you enjoy science, particularly biology and physics, there's a lot of biology involved, and physics as well, to be able to understand how the machines work. You need to be able to be motivated to study. As I mentioned before, you have 1 day a week to study and 4 days a week you're in the hospital. So you need to be able to put in a little bit of time in the evenings or weekends to be able to study, because it's quite a lot of work to do in 1 day. If you can work independently, a lot of your work will be done on your own. There is a little bit of teamwork involved, but a lot of your work is just with you and a patient. And if you want to earn while you study, as I mentioned before, you're not paying for your degree. That's completely covered by your employer, and you get to earn a wage at the same time. So it's a really great way of getting a degree. You get hands-on training. From day one, you'll be in the hospital. People will teach you how to perform the tests, and eventually you'll be performing them on your own. So it's a really good way of applying your knowledge in a clinical situation. It's a really good way of learning, in my opinion. If you'd like a degree, but you're not sure about going to university, you can always look around at local hospitals and see what degree apprenticeships they're offering. If it's something you're interested in furthering your knowledge and getting a degree, but you're not sure about travelling away to university, this is a great way of doing it. And then you're almost guaranteed a job afterwards as well. You become qualified in a job that is competitive for training, but there are lots of job opportunities. So the neurophysiology is particularly niche and quite difficult to get into, but when you do this apprenticeship, there are so many job opportunities. Once you qualify, you're not limited to staying where you are. There are many hospitals and they're always looking for new neurophysiologists. You're highly likely to be employed after graduation, so your NHS trust has spent a lot of time training you, so they want you to stay afterwards. So if you're worried about coming out of a degree and not having a job, that's not a problem with an apprenticeship, because they don't want to lose you after you're trained. And if you don't want a student loan, because you don't have anything to pay off after this degree apprenticeship, it's all covered for by the NHS trust that employs you. Any questions?
Thank you, Abigail, for that really interesting and great talk, and lots of really good information for our students watching out there. So if students would like to put their questions in the chat, we are going to answer them now. Okay, so I'm just going to have a look now to see. So the first question that has come through is, so how do I apply for an apprenticeship with the NHS?
So how I did it was through NHS jobs. So I would recommend you can always, when you go onto the NHS jobs website, you can filter it by location if you're only looking to stay locally, or you can leave it open for anywhere, and you can either type in apprenticeship and see what comes up, because there are apprenticeships in other fields as well. There are cardiac physiologists, respiratory physiologists, engineers, nuclear physicists, so it's not all just neurophysiology. There are plenty out there. So if you're open to other things, just type in an apprenticeship and see what comes up. You can apply through that.
Sorry, yes, that's really good. That's really good to know. Okay, and we can provide everybody with the link, that link as well, can't we? So they can have a look for themselves. Okay, so the next question is, what's the favourite part of your work?
I would say probably the patients. I like talking to people. I like that every day I get to meet new people, and it's always something different. Everyone's got good stories. You get to spend a nice amount of time with a patient. It's not a 10-minute appointment. Most tests are at least an hour long, so you've got a long time. I really like meeting new people, and yeah, I find that really interesting.
Okay, how much time do you spend studying a week?
I spend my working day on a Wednesday, so I would normally do just 9 to 5 on a Wednesday. My NHS trusts are quite understanding. I'm now in my 3rd year of my apprenticeship, so I'm just about to finish, so the workload's quite high. So they're often giving me extra time. If patients don't turn up, then I get to do extra time during the day, and I often spend a bit of time on the weekend as well. I would probably say at the minute I'm spending about 15 hours. It's not excessive, but obviously you've got a full-time job as well, so it's just balancing that where you can. Okay,
so you're definitely quite busy there. Definitely.
Yes.
Okay, so I've got a question that's just come through. Was there any one thing that really inspired you at school entering the course and profession?
So I always enjoyed science. The lectures and lessons I always enjoyed. I actually had some STEM talks when I was at school, and I always found those really interesting. And then I think it probably helped. My mum worked in science as well, so I found that really interesting. I wouldn't say one particular thing, but I think it's really important to do what you enjoy. Don't force it. If you don't enjoy science, obviously don't do it. But if it's something you think you're interested in, there are so many different fields within science. It's not just one thing. I think there's something out there for everyone, really.
Definitely. Okay, another question's come through. How challenging was your work interacting with the patients?
I think it's something that you get better at with time. When you first start, it's a lot of observing anyway. You're not left straight your first day, you're not left alone with a patient or anything like that. It's very gradual. You'll see how other people interact with patients and learning different situations. Talking to parents with a young child is very different talking to someone my own age, and it's very different talking to a 5-year-old. So it's all very varied. So you get time to watch and see how other people do that. But I think it comes quite naturally. It doesn't feel, obviously you have to be very professional, but at the same time, it doesn't feel like you're being examined for what you're doing. You're just talking to someone, and it does come easily eventually.
Okay. What do you hope to do with your apprenticeship?
So I hope to stay in neurophysiology. So once I qualify, I'll be a qualified technician, and I perform more tests alone. Eventually, there are other things that I can add on. You can go into surgery with this degree. You can not actually performing the surgery, but monitoring surgeries. So it's quite an important part of a surgical team. So you're involved in monitoring the brain when they're doing brain surgery and spinal surgery. So that's something that I might consider later on. But you can also just expand your knowledge and just become more autonomous. There are more tests to learn, and there's always something else to learn. So I plan to stay within the field.
Okay, that's great. I mean, that answers a question that we've already had here about other things that you can do with a neurophysiology degree apprentice. Can you do anything like going to research, or is that separate?
I think for a lot of NHS trusts, although you would be qualified as a technician and you would be doing this role, quite a few NHS trusts are very flexible with if you decided research was something you were interested in, whether you did 1 or 2 days a week working on a research project. I know quite a few people have little side projects going. So although you wouldn't just go into research with it, you would probably incorporate it into your everyday. You might be able to do some research. I know quite a few people have gone on to do other work within the NHS, sort of promoting apprenticeships, promoting neurophysiology. It doesn't have to be all staying within doing the job. A lot of people then go on to sort of managerial positions as well.
Okay, that's great. So I've got a question. Do you work with other departments?
We do a little bit. During your degree as well, you get to go to other departments to see how they work. So in my first year, it's compulsory that you go to audiology and ophthalmology. So you learn about the ears and the eyes, because we do visual tests as well, looking at the nerves to do with the visual system and the auditory system as well. So there is a little bit of overlap where you'll have other departments contact you about a patient. Also, a lot of patients that are coming for anything to do with the brain might have had imaging done, so you can always have a little bit of experience going to one of those departments to see what they do. And we cooperate with the wards and the ITUs as well, so there's a lot of overlap with other departments as well.
Okay, so that's actually all the questions that we've had here through to today. If anybody's got any further questions, I'm sure if they email the STEM Hub, Abigail will be happy to answer those questions. So that's the STEM Hub at canterbury.ac.uk. And thank you ever so much for giving that great talk, Abigail, and answering everybody's questions for them. And thank you everybody watching it at school as well.
Great, thank you.